Take this catheter, stick it in your arm here, and they're looking up at an x-ray machine. It goes all the way here, and they go and clean it out. Or sometimes what they do is they take, instead of a brush here, they take and they stick like a little balloon inside there, and the little balloon can keep your arteries open. Sometimes what they do is they stick something that looks like a little spring. It's called a stent. They stick it inside there, and they hit a little switch out here, and it goes doink, and it's a little spring that actually stays inside your artery, keep your arteries open, so that your blood flow can flow through there. That's called a stent. But that's what they do to treat people that have these blocked arteries. It's usually from smoking, from dieting, and they're all blocked up.
Dieting to like lose weight?
No, not dieting. Meaning, when I say your diet, it means what you eat. So there's people that eat a lot of fatty food, French fries, and hamburgers, and they eat too much junk food, and all the fat builds up inside their arteries.
Which causes heart attack, right?
Which causes a heart attack.
Can you get that if you're not fat?
Yep, you can get that other different ways. You can get that from a family history of it. Some people have a family history of heart disease, and what that means, like I have a family history of heart disease, and what that means is that I was just born with thinner blood vessels than what I was supposed to have. Thin blood vessels, right? Everybody's born with different sized feet, different sized nose, different sized ears, different sized hands, and some people are just born with different sized blood vessels. So my blood vessels are thinner than what they're supposed to. So I have to take a pill every day to keep my arteries open because I have a family history of this. Drugs is another one. There's certain drugs. There's some drugs that can actually constrict your blood vessels. Tobacco is a drug, or smoking is a drug that actually constricts your blood vessels over a period of time. You think if you have a cigarette, your blood vessels go whoop, tighten up and you die? Of course not. That doesn't happen. It happens over a period of time that your blood vessels start to tense up. However, there's certain drugs that can do it right away. For example, cocaine is a drug. Cocaine is the kind of drug that if somebody takes a really hard hit of cocaine, a really heavy, powerful cocaine, it can actually constrict your blood vessels immediately. Boop. So that when people die of a cocaine overdose, they show up in the emergency room and they say they died of a cocaine overdose. What they really died of was a heart attack because they constricted your blood vessel right away. Bam! You can't get oxygen to your heart and you die. So anyway, that's what a heart attack is. This is how we treat it at the hospital. And there's a risk factor, how you get it. Do we have a question on heart disease? No? All right. The second leading cause of death in America, we just said it, was cancer, right? Everybody's heard of cancer. But not a lot of people know what cancer really is. Cancer is inside of our body. We have a bunch of cells. And these cells multiply and break down all the time. And then under normal functioning system, they continue to reproduce and break down. But what happens sometimes is that instead of breaking down and reproducing, they keep growing out of control on top of each other like this. So that this abnormal growth of cells is what cancer is. It's an abnormal growth of cells. And sometimes you can actually feel that. You can actually feel these abnormal growth of cells. And when you can actually feel it, they're called tumors. Sometimes people have tumors and you can actually feel them. So we know that smoking is a big risk factor when people have cancer. What's in cigarettes that causes cancer? Does anybody know? What is this though? Tar, very good. Yeah, I'm sure when you're in second or third grade, you always see the little tar jar. And this is how much tar collects inside your lungs if you smoke cigarettes for 1 year. If you smoke a pack of cigarettes a day for 1 year, this is how much tar collects inside your lungs. Yeah, sure, tar. Yeah. They take a pack of cigarettes and they look extra gross. So now I want you to think about somebody who you know that smokes cigarettes, and I want you to think about how many years they smoked for. Like every time I hold this up, I always think of my grandpa. My grandpa smoked for 40 years. He had 40 times this amount of tar inside his lungs before he died. That's pretty nasty, right? It's hard to imagine how people could possibly breathe when they have this much tar inside their lungs. But somehow they do it. We know that smoking is a big risk factor for cancer. When people smoke cigarettes, they can get cancer in all different parts of the body. You see, a lot of times people think, well, if you smoke cigarettes, you get lung cancer. Well, that's true. But the reality is, if I smoke cigarettes, if this is a cigarette, and I burn this and I'm smoking it, you think it's possible for me to get mouth cancer from this cigarette? Sure, of course. And then it goes, what's that? Yes, sure. So I breathe it in down to my throat, and I get throat cancer from this? Sure, of course. It goes into my lungs, and of course I can get lung cancer. But cancer cells are really, really small. They're microscopic, and they get really small. And what happens is they get into your bloodstream, and it goes anywhere your blood goes. And where does your blood go? To the heart. Yeah, it goes everywhere. It goes to your heart, to your brain, to your kidneys. You think you get brain cancer just from smoking a cigarette? Sure, of course. Can you get kidney cancer where you pee from just from smoking a cigarette? Yeah. Can you get colon cancer where you poop from just from smoking a cigarette? Yeah. Ladies, can you get breast cancer just from smoking a cigarette? Of course you can. You get cancer anywhere in your body from smoking a cigarette. So that's what cancer is, and that's how you get it. Anybody know how you treat cancer? How do we treat cancer at the hospital? How do you guys think we treat cancer at the hospital?
Mr. Christie saying he can't teach about this kind of stuff. What kind of stuff is that?
These are the 3 ways that you treat cancer at the hospital. So the way you treat cancer at the hospital is one of the ways is chemotherapy. And everybody's heard of chemotherapy, but what that is, they stick the needle in your arm, they send chemicals throughout your body. The word chemo refers to chemicals, and the word therapy refers to treatment. So it's treatment with chemicals, right? So they send all these chemicals throughout your body to try to kill off the bad cells. Well, that's good, but what else does it do besides kill all the bad cells? Very good. It kills a lot of good cells. It kills the cells responsible for hair growth. When people lose their hair when they do chemotherapy. It kills the cells responsible for pigmentation, when people get real pale and real white when they're on chemotherapy. It kills the cells responsible for your stomach working properly, so people get real sick to their stomach. People get the poops and the pukes all the time when they're on chemotherapy. They feel terrible because it makes them really sick. It's because this chemotherapy kills a lot of these bad cells. But while it's going after all these bad boys, it also kills some good cells that we need for other parts of our functioning body. But that's one of the ways, chemo. Radiation is the other way that we treat cancer inside of the hospital. And what radiation is, it's a really heavy powered X-ray that actually tries to shrink these. So for example, if you have lungs like this, say these are your lungs, breathing tube, and they find a little lung tumor, let's say right there. And what they do is they lay you on this table, they stick you in this X-ray machine, and there's this really big, heavy powered X-ray machine that goes and it actually tries to zap this, a continuous X-ray beam right on this. And they're actually trying to shrink this cell down. And that's what radiation therapy, when they're actually trying to shrink the cell. And that works pretty well if you have cancer just on one isolated spot. But the problem is that you might have cancer here. So that you can't like radiate all that stuff, but you won't have any tissue left. So what's the most effective way to treat cancer? This is the most effective way. The best way to treat it is to cut it out. So somebody has a lung cancer right there and they find out that it's only right here, it's not anywhere else.
Will you die if you cut it out?
Can you cut it out? Can you cut out this part of your lung right here, man? And can you just live with one?
You can take a lung out.
Can you do that? Can you just live with one
No.
lung?
No.
You can. There's a lot of people who live with one half. What if you have cancer here? Can they take out one of your lungs? Can you take out a whole lung and block it up here?
Yeah.
Can people live with just one lung?
Yeah.
Sure they can.
Yeah, my grandma does.
Yeah, sure you can live with just one lung. Can you live with no lungs? Can they take out both your lungs? No, you can't live with no lungs. What if you have cancer in your tongue? You think they go inside and just cut out your tongue?
No.
Yeah, that's what they do. What if you have cancer of your ear? You think they go out and cut out your ear?
No.
Yep, that's what you do.
That's why I'm saying I'm shutting up.
What you do is if you have cancer and it's isolated in just one spot, they surgically go inside and just cut it out. What if you have cancer of your throat? Can they just go in and cut out your throat?
Yeah, hole in your throat has on
Looking for
Yeah, that's right. They go inside and surgically remove
What
the
if you
throat.
got cancer in the
It's in the private area.
Go ahead, use the right term and say it. If you have cancer of your penis, think they go in and just cut off your penis?
Yeah.
Yes, they do. Well, you know, speaking of that, one of the things that we talked about is a family history. Is a family history of cancer.
Oh my God!
So I think it's important for you guys to know that if you have a family history of cancer, that's very important for you to know that you check regularly for these tumors. And ladies, it's really important for you to know, I think you're mature enough to get this, but it's important for you to know that if you have a family history of cancer, that it's really important that you check regularly for these lumps. You're checking your breast regularly to see if you feel lumps on there. And guys, that's good. That's really good. And guys, what kind of cancer you guys between the ages of 15 and 25 get? What's the most common cancer for young guys between the age of 15 and 25. I want one of you guys to tell me. What do you